Well, Whitey Herzog is said to be doing well following a minor stroke. It was about 10 days ago. It happened after too much exposure to the heat during the 87-year-old's charity golf tournament. It was at Forest Hills Country Club. 3 days later, Whitey was out and about making a personal appearance, signing autographs, and that's after having a minor stroke. Well, how is that compared to a stroke, a regular stroke? Well, we've got SSM Health St. Mary's neurologist, Dr. Vikas Kumar. He joins us to explain the difference. And doctor, thank you so much for coming in, because this is a subject that we should always be talking about, because you never know when it could happen.
Right. The stroke is a major neurological problem. And minor stroke, also called mini stroke or TIA, transient ischemic attack, it's a transient neurological dysfunction of the brain or the spinal cord or the retina in the eye. But it's a warning sign. It's a heralding kind of a sign that a major stroke can happen in few people in the next coming months. It should be taken very, very seriously.
So a minor stroke doesn't cause any permanent damage?
Right. It's a transient dysfunction. It happens, somehow the blood clot dissolves in the brain and the person returns back to their normal state. So it doesn't cause a permanent functional deficit. But if it becomes a major stroke in the coming if another stroke happens in the next few weeks or months, that can be devastating to the patients.
Are you not surprised that it happened in extreme heat?
Right. I mean, hot weather, stress, those can put a stress in the body and the brain and can lead to some changes in the body, which can lead to the stroke, yeah.
So what would one do after having this minor stroke so they don't have a regular major stroke?
Right. So the first thing is call, I think, 911, even for the minor stroke. Generally, we admit the patients for observation and screen for the risk factors. So screen for any pre-existing conditions like hypertension, diabetes, any abnormal rhythm in the heart, any major blood clot or disorders, or narrowing the arteries in the neck, which are the major blood vessels supplying to the brain, because those, if not treated, can put you at risk for major stroke.
You may also begin to take a new type of medication as well.
Right, right. So there are a lot of different blood thinners which can be appropriately prescribed for different kind of a stroke prevention.
Mm-hmm. And as far as having a major stroke, I mean, that can be a life-changing event. It can lead to paralysis, mental issues, all kinds of nasty
Right.
things.
A major stroke can lead to significant weakness of one side of the body or the other. It can leave with some permanent functional deficits, cognitive disorder, difficulty with balance, difficulty with ambulation. There are functional scales which are used to categorize the severity of the major stroke, and these people require long-term rehabilitation.
What should symptoms be? What should somebody look for if they think they're having a mini or major?
Right, so the main symptoms are, it's a sudden onset, transient symptoms of one-sided weakness involving the face or the arm or the leg, numbness of the face or the arm or the leg, language deficits, difficulty with understanding people, difficulty with expressing their thoughts, sudden loss of vision involving one or both eyes, dizziness, severe dizziness, loss of balance, difficulty with gait, all those severe headache, most severe headache of your life. That can be also a sign of a stroke.
All right. So always take it seriously. Dr. Kumar, thank you so much. We appreciate it from St. Mary's Hospital. Margie?
All right.